Set 29 CDASH Technical question and answers. Answers are highlighted in green. Question 1. Which CDASH variable is used to capture the date of a subject's informed consent? Option A, visit date. Now this is related to the visit date, right? Option B is in VDTC. That is the investigator date. ICSDTC. This is your informed consent date in CDASH. RAND DTC is nothing but related to your randomization date. So option A is not the right answer. Option B is not the right answer. Option D is not the right answer because this is related to visit. This is related to investigator. This is related to the randomization. And option C is related to the informed consent date. So the answer is ICSDTC captures the informed consent date in CDASH. Question 2. In the demographics DM domain, which CDASH variable is used to record the subject's age unit? Option B, unit age. This is not the right answer. Age unit. This is also not the specific right answer. D, age U. This is also not the right answer. So the correct answer is age U captures the unit of age such as years or months. Question 3. What does the CDASH variable Q name represent in supplementary qualifiers? Option A, question code. No. Now remember one thing, NAM is related to your name, right? And we are considering the qualifiers. So the answer is itself in the question. So the correct answer is C. So the option B is the question text is not the right answer. Questionnaire name is not the right answer because we are not asking the questionnaire, right? The question is about the qualifiers and NAM suggests your name. So the correct answer is C. QName represents the name of the qualifier being added to the domain using supplementary structure. So the correct answer is C, qualifier name. Question 4. Which CDASH is used to collect the prior medication information? Option A says EX, which is related to exposure. Option C, which is PR. So this is also not the right answer. Option D says MH, which is related to the medical history, not the concomitant medication. So any ongoing concomitant medication or any prior medication which is being taken during the clinical trial, that goes into the CM. So CM is used to collect the prior medication information. So the correct answer is B, which is CM. Concomitant medications captures prior, concomitant and sometimes post-study medications. Question 5. In CDASH, which variable is mandatory for capturing the status of a visit? Option A says visit. Now this is related only to the visit, so this is not the right answer. Option B says visit DY. Now DY stands for the day, so this is also not the right answer. Option D says visit num. Now this is related to your num, which is your visit number, right? So this is also not the right answer. Now option C says visit STAT. Now STAT is nothing but your status. So this is your status, right? So the correct answer is C. So visit stat helps identify if a visit was completed, missed or not applicable. Question 6. What is the purpose of the PREPS variable in CDASH? Now option A says indicates whether pre-study data was collected. No. Records test result. No. It stores test unit. No. So the correct answer it denotes presence or absence of a specific event or a test. So the correct answer is B. Now this variable is used to indicate whether an adverse event or finding was present or not. Question 7. Which CDASH variable links a test result to a standardized terminology? Option A says test. Now this is related to the test of specific lab related, right? So this is not the right answer. TRT is related to your treatment. So this is also not the right answer. Now TERM is the term used to mention the adverse events, which is your verbatim term. So this is also not the right answer. So the correct answer is D code. So option D is the right answer, which is used for the standardized terminology. So D code stores the coded term from a dictionary which is related to MEDRA or WHO drug. Question 8. In the CDASH implementation guide, how should missing start dates for adverse events be handled? Use 999-12-31. So this is not the right answer. You leave the value as blank. No. Use unknown. No, you cannot use unknown or blank, especially for missing start dates or adverse events. So you can use the partial date if it is known. So if any dates that are present, especially even if there is only year information present, you can mention only year or whatever the value is available, either date, month or year or everything. So you can use partial date if it is known. CDASH allows collection of partial dates when full dates are unknown, especially in AE and CM domains. Question 9. In CDASH, which variable is used to indicate if the subject was randomized? Now option A says RAND. So this is not the right answer. Option B says random. This is also not the right answer. Now RND STAT is nothing but the randomization status. So this is also not the right answer. Now the question is whether to indicate if the subject was randomized, whether yes or no. So when you see this, so this is my Y and N. So the correct answer is C. So randomization YN indicates whether the subject was randomized, yes, no or unknown. Question 10. Which C-dash variable captures the main reason for discontinuation from the study? Option A says DCRES. Now this is not the right answer. DSREES. No. Then option D says DIAC disc and start, which is also not the right answer. So the correct answer is option B, which is related to the discontinuation and the reasons, right? So DCSREAS captures the reason why a subject discontinued from the study, such as AA or withdrawal or etc. Please like, share and subscribe. Leave a feedback comment mentioning any topic that you want me to make a video. Looking forward for a positive response. Thanks for watching. Please like, share and subscribe. Leave a feedback comment. Many thanks for your support and having great connection.